rather small, so I can sit and retype it, Nick. The first, it starts off with what are people's thoughts on the findings? Does anything resonate?
That was it.
Is that the right one, Nick? Am I on the right page?
That was the one. That was what I was looking for.
And then what are you most proud of? What are the main reasons your site work? Should it be sustainable? To what extent are you able to demonstrate this? And then, so there's the good stuff, and then the biggest challenges, and then topics and shared learning you'd like to discuss. I'll type this out from that screenshot, Nick.
Fantastic. So, welcome everybody. How many have we got? 1, 2, 3, 4, 5, 6, 7, 8. I think we're a small enough group just to very, very quickly go around and introduce ourselves. Just sort of one line, and as Sue said, with the questions. So the first question is, anything resonate? So why don't you just introduce yourself and just one sentence of anything that you've heard this morning that you sort of said, yes, that feels spot on, sort of thing. So I'm going to go as people appear around the screen on my screen. So Muqtadir from East Cheshire. So just say who you are and anything that particularly resonated with you. You need to come off mute. Or should we come back? So whilst you look at your unmuting, what about Marie Derbyshire from South Sefton? Hi.
Hi, thank you. Yes, I'm a project and performance manager from South Sefton, and yes, I suppose there's lots of work going on in South Sefton trying to reduce health inequalities. We have a very large social prescribing team, and I think listening to a lot of what people say, yes, similar issues, and a lot of work being done around working towards support around helping people with when people were talking about, you know, Maslow's hierarchy and things like that, those basic needs to try and help them to move forward before sometimes they can address those health issues.
Fantastic. So that Maslow hierarchy of need. Leslie, I'm not sure where you are actually. You tell us.
This Leslie, Nick.
Your first Leslie, yes, yeah, Leslie Watkins, indeed.
I am Leslie Watkins. I'm from Mansfield CVS, and we work on the health inequalities work in Mansfield district in some of the most disadvantaged wards. And again, I think, you know, the Maslow stuff really does resonate. You know, we're currently doing a lot of partnership work on an estate that has no healthcare facilities, very little facilities at all, but we've managed to secure some funding, and we've got Citizens Advice now working on that estate. And it's great because they're really unpicking a lot of things for residents residents are not in a position to prioritise their own health and well-being because there's so much going off in their lives that they need help, and poverty is just a massive driver. So everything that I've heard this morning really resonates for the inequalities work we're doing in Mansfield, which is, if people don't know, is in North Nottinghamshire.
Fantastic. Claire, lovely to see you. Claire Hunter.
Hi, yeah, so I'm Claire Hunter. I work for Somerset Activities and Sports Partnership, but for CCCP we are working in partnership with Bridgewater Bay PCN in Somerset. So much this morning has really resonated, but I think that the sort of the access to materials and the literacy thing is something that is very close to my heart, and I think it really that demonstration of what it takes to bring the reading level down to a really accessible level, I think is really quite a powerful thing to be thinking about, because so many of us just communicate the way we communicate without thinking very hard about exactly who we're speaking to and what what they are looking for and what they can engage with comfortably. So yeah, that's something that I found really interesting this morning.
Fantastic. Rachel Stead.
Hi, I work with Marine South Sefton, which is just north of Liverpool. So I guess I think there's been a couple of things for me, and I think certainly where I think we need to go next is thinking about literacy and reading age, and particularly the idea that libraries are trusted places, and clearly for an awful lot of the population, a more trusted place than a health centre. And I guess the other thing that I think would chimes with some of our experience is that are struggling with things like food poverty.
Did others? I missed that last sentence. Did others miss it? Just
Yes, you
repeat your
cut
last
out.
sentence, Rachel.
Uh,
You said
is
libraries
that
were
any
trusted
better now?
places, and then we lost it, I think.
Can you hear me still? No?
We can, yeah.
Okay. Yeah, I was just saying that I think the idea that one of the other learning about things that just weren't a priority for people in terms of that fatty liver project. I think we've probably learned that things that we think should be a priority for people just aren't always a priority in particularly addressing things like food poverty. So yeah, I think there's been a few things for us to think further about as we continue to develop our project.
Fantastic. Kate, nice to see you.
Hi everyone, I'm Kate Bell and I'm working Congleton and Holmes Chapel in Cheshire East. For me, it's been interesting, all the health literacy, been very interesting in our trust. We've done a little bit about Easy Read, but it's been very much from the point of view of people with learning disabilities. So I think it's interesting that we need to think even wider than that. It's not just people with learning disabilities. It's all could be all people with a much lower reading age. So I think there's some lessons there that we need to apply that a bit wider. And very interesting the link with the libraries, that our local authority are reducing the hours, opening hours of our libraries to cut costs. So reducing access for people, and we have actually got our community development officers are looking at setting up some programs, some volunteer programs where we're getting younger children from schools in to do sessions for anyone who is struggling with IT and tech, to come and help them to set with whatever it is with their phone or computer. But actually we could, once that gets up and running, look at having a more health angle on that, and looking at the access to NHS account and things like that would be interesting. Thank you.
Excellent. And Claire Williams.
Hello again.
Hi.
So I'm Claire Williams. I work for SASP, like Claire Hunter. I am a health and wellbeing families coach, but I also lead on a project called Moving Mums, which I work with women, predominantly families, to encourage movement and a positive health and wellbeing approach towards life. So yeah, this morning is really familiar to my role, because I do work with families that are in quite a deprived area. So it's all very familiar to my role. And I have lots of mums that basically can't even afford to go to the dentist and things. So, it really does resonate with kind of those type of stories, with how I try and help, give them, the understanding of kind of how they can go around these, and just, support with, making those decisions, and how they can go about getting that kind of care which they're struggling with. So but the other thing I wanted to share as well is that I have noticed that my son's school in Bridgewater, which is quite a deprived area again, they are offering GCSE maths and English to the parents. So I've noticed that they have been sharing that recently, and I thought that was really good.
Fantastic. So there's this a theme of schools and lots of other organisations coming together beyond the NHS. Sophie.
Thank you. I'm Sophie Clark, and I work with Knutsford Care Community in Cheshire East. So yeah, I found it really interesting this morning, actually. I think definitely this stuff around health literacy, I think it's given me lots of food for thought. The stuff around social prescribing, I found that quite encouraging, actually, because I think in Knutsford, we've got Knutsford Together, who is like a social prescribing plus model, and we were able to go much further than the sort of GP linked social prescribers. So I think that's really interesting to see that it's been recognised as such a valuable asset, I guess, and I feel like we're moving in the right direction in terms of that. But I think there was something mentioned at the beginning just about really understanding what people want locally. And I feel like maybe with some of our projects, we could be doing a bit more listening to members of the community, I guess, and just really understanding what I feel like perhaps we need to do a bit more around that. And it's just, yeah.
I
think
agree.
that's what I'd take away.
For me, that's been one of the big themes of this whole programme, actually, is the importance of the listening. It's slow, it's hard work, it's real work, but it's absolutely, it creates the foundation, creates relationship, creates resilience, you're better off listening for a while than diving in with a slightly misjudged service.
And you're putting the right thing in place then, aren't you, first time rather than, So, thank you.
Anne-Marie.
Hi, thank you. I'm Anne-Marie and I'm from Central Liverpool Primary Care Network. I'm the Health Inequalities Non-Clinical Lead and Health and Wellbeing Delivery Manager. So I sit over all of our health and wellbeing work. Lots resonated with me this morning. And what I've written down is I would be really worried if it didn't resonate with everybody on this call because we are preaching to the converted, and I'm really interested in getting out of these conversations and getting into some conversations with the non-converted. I don't know quite how to do that yet. I've been having the same conversation for 20 years. I've been listening to the same fantastic work going on, no doubt about it. There's nothing new here, unless I'm missing something. So that annoys me a little bit. No, I'm not annoyed with the individuals on this call. I'm annoyed with the bigger system that we're still having these conversations. Social prescribing is one of my passions. And I think what was missing today was talking about individuals' assets. So we talk a lot about deficits and problems. We talk about community assets. I'm really interested in understanding individual assets and how we better work with those, because, people in our communities aren't just problems, they have loads of solutions themselves. And I think sometimes social prescribing doesn't do that very well. And last thing I'll say is what I was really pleased about is it's relationships, it's time to have conversations and develop relationships, both with individuals and communities and stakeholders, other organizations, and everybody really talked about the importance of that.
Fantastic. Well, I share your frustration and around the spread sort of stuff. But so the question for this group is going to be sustainability, which I suppose is another version. It's sustainability and spread, and it's going to have to be down to people like us to light the fire. So that's what the conversation will be, I think. So Pauline.
Good morning. I'm Pauline. I work in Southend Victoria PCN. So we've got one of the most deprived surgeries in our area. And I really echo what you just said, Anne-Marie. I asked a question about getting NHS access without photo ID, and I'd had a conversation with our digital lead, and it just went nowhere. It was like, well, you have to have ID, the end. And I thought, oh, it's just hard when the conversations just stop.
Room 2. Yeah. Oh,
and so
the computer says no.
Computer says no. Why don't they have ID? That's ridiculous. Next problem. And so yeah, I was really grateful that I was able to answer that question. But yeah, it's just when life's hard and the conversations are hard, they're the ones that we stop, but they're the ones that we need to push on and go back to. But when life is hard, you just think, okay, I'll choose the easy route for now and come back to it. But it's trying to find that energy to go, no, let's investigate this further. So I think the libraries are probably where I will have another conversation and see, can we get, because one of the it's understanding, isn't it? What's your motivation? Well, digital lead motivation is to get more people using the app. So right, let's get out to the library and see if we can work together. So yeah.
It's being rolled out now, Nick, and there was a film made at Leeds Public Library quite recently, so there's more material coming out from the NHS app. And I think, Pauline, that I put in a link around the piece around photo ID into the chat earlier, because that's just not true.
So I've sent that on.
Fantastic. Jodie.
Hi everyone, I was just busily typing. So my name's Jodie. I am the operational lead for the Health Equity NHS team in the east of England, and my role is that I have the CCCP within my portfolio. So I don't do any of the work, but I'm really interested. I've found today really fantastic, actually. I just wanted to say about the app. I was at the NHS engagement session on Wednesday, I think it was. All my days have merged, and we said about the NHS app is actually, one of the worst examples of reasonable adjustments or meeting people's needs. It's the one thing that they want everybody to use, but actually, unless you're white, middle-aged or young, you're probably not going to be able to access it. So we did say that it needs a lot of work to be fit for purpose. The other thing that I also do is I host webinars across the east of England, but anybody can join them. And I do have one planned for health literacy in a couple of months, because I think it's one of the most important things that you can do. And I also think it's probably the most underestimated aspect when people are delivering work. So in our program, they do a lot around cardiovascular disease prevention and etc. And I keep saying to them, but if you can't read the label on the medication, or if you can't understand what's being said to you, it doesn't actually make any difference. You can give people all the pills that they want or don't need or anything like that, but if they actually don't understand the message, or it doesn't resonate with them, it's pointless. And it's funny, and I think because this is recorded, isn't it? Public health consultants, but just ignore that. And they're not clinicians, and so that there is that little bit disconnect. So anyway, I am thrilled. I can't wait to get the slides, and I'm probably going to poach some of you to present at my webinar as well. But yeah, it's been great. So thank you.
Fantastic. And Benedict, welcome. It was just introducing people and say anything particular resonated from what you heard this morning with you.
Oh, a thousand apologies, Nick. I've been looking after my my daughter with norovirus. So
no, priorities understood.
My wife has taken over, and so freed me up. So I missed the morning part. So
okay. Well, welcome anyway. But you're more than welcome. And Jita, last but not least.
I work at the site in Birmingham, so Caritas is our PCN, and been working with Nick on social prescribing into redesigning the maternity pathway with adding social prescribers in looking at reducing neonatal deaths. And what I found really interesting in today's workshop was around the conversation around surveys, because I always find patients get really frustrated and annoyed with me in regards to doing a survey. They're not interested, it breaks trust, and it sort of puts up a barrier, and yet it's required. So that I always find that a little bit tricky and difficult, but just explore different ways of collecting information was quite interesting. And then it also had a thought about, we're looking at reading levels, but I find even if someone can read and English is not their second language, then there's another layer of comprehension, but the comprehension is So they may be able to, now that they can read the language, do they comprehend the sentence? And I found really interesting responses to that, that it's not as clear cut as you wouldn't, if they can read at a 9-year-old level, for say, the comprehension is not always matching. So I just wanted to share that. And also just, you know, when we have done patient engagements, and Nick would know, you know, there was a real response for a walking group, but when we actually conducted the walking group, then the social aspect of community affected the success of the walking group. What would people think? I'm walking with strangers. Or, you know, what would my community think? I'm walking with these. So there's many layers of community and culture and just neighborhood politics that sort of really affect interaction.
Fantastic.
But yes, thank you.
So I mean, again, I mean, lots of themes, I think, from the things you've said, you know, the importance of libraries, the literacy, the social prescribing, poverty, engagement. But I think Anne-Marie's part, it is, I mean, I've been so struck by the inspiration, not just of what we heard presented today, but of all the projects I've seen and the huge difference to people's lives that people are making, and the common threads about real understanding, real engagement, working with, responding to, walking in other people's shoes has I think really sung through. But I really did hear Anne-Marie's pain when she said, "No, people have been talking about asset-based community development and all sorts of other things for donkey's years, but the NHS hasn't really sort of picked it up and run with it." And I think for lots of other partners in communities, they find the NHS a very difficult organisation to work with. So what I would really like us all to think about is how do we take the inspiration, the lessons that you've all been learning, how do we collectively help use those to scale and spread and sustain the fantastic work that you've been doing? If you had magic wands, what would change? What would be different? What would the NHS do differently to help support, sustain and spread the magnificent stuff you've all been doing? And I think this is just stick hands up and shout and have a collective conversation. Muqtadir.
Sorry, I couldn't introduce myself before. Something happened with my mic. It wasn't turning off. I'm Muq. I'm from East Cheshire Trust. I cover the Wilmslow, Alderley Edge, Chelmsford and Hanforth area. I just wanted to say about what you just said now, Nicholas, about engagement. I think it needs a real focus on engagement. A lot of quality intel I get is from doing, when we do with Sophie and Kate, we do a lot of living well events, smaller health and wellbeing fairs, which kind of works in smaller care communities, but it can be real difficult as well with accessibility and access to reading and things like that. But for me, it's about actually how do we delve into care communities, look at what population we've got and put some sort of face-to-face events. So what we do in Chelmsford and Alderley Edge and Wilmslow is we put some sort of health and living well events, where we target patients to actually come with the support from social prescribers and the PCN to be able to actually talk to our patients within that care community. So that has been working, and that has been really positive as well.
Fantastic, thank you. So the comments appearing in the chat, not least from Jodie saying give the money to the voluntary sector. Rachel.
Thanks. I'd definitely give more money to the voluntary sector. I think one of the things that I think happens in particularly in general practice is that we are paid for success rather than effort. And I think there's some really good examples of that, like things like childhood immunisations, where you're only paid if you are successful in vaccinating a child, but the amount of effort that is required to engage some families or to build trust, none of that is paid for. And as a result of that, people don't do it because they can't afford to not be paid, and therefore put efforts into something where success is more likely to be guaranteed. So actually, far from having, you know, these indicators encouraging a focus on increasing things like immunisations, it actually does in my experience, the polar opposite. And I think the fact that general practice and the wider sector are not trusted around understanding the need for that engagement is that, if I had a magic wand, trust and removal of these ridiculous arbitrary indicators would be absolutely where I'd be. Thanks.
Sue, can you take over just for a few minutes? I've got to my apologies, drawbacks of working from home. I'll be back in a second.
I've got builders too. It's unbelievable. Yeah, of course, Nick. Of course. Good luck.
Okay.
I'm just typing in there a comment. I mean, I've actually been working on this for about 40 years. I introduced a telephone information service with the public, which had which used tapes, audio tapes recorded by actors in multiple languages. That was 1987. And I think my point around that is partly that, and what I was typing away there, I chair this Health and Literacy Partnership, which is Arts Council England, Libraries Connected, the Public Library Network, CILIT, because it takes us into school librarians and others, and the national team, Knowledge and Library Services team, which I used to head up as CKO. And what we set ourselves up to do 2 years ago was to develop a sustainable partnership around the library side of this, because inevitably this isn't work you do once. This needs to be an embedded approach to how you work with community. There'll be new people coming through, new people with reading challenges and all the rest. So, and that has proven to be an enormous challenge. And I might be a little bit controversial and say that some of that, as in so many areas, is that it's very difficult to build a coalition. We're the willing and we're the converted, but building a coalition of people who are all fighting for very tiny pots of money to do slightly different things. And we haven't even gone into the piece around who's working on digital literacy, data banks, you know, getting a very high profile because that matches government, you know, that matches government policy, without seeming to grasp that that's just a starting point for those people who will be able to use those methods. It's just having digital connection and data is just the point at which all this starts. And, you know, so I think there is a real challenge for us, and it's easier to do at community level sometimes than national level. But I really think there's an opportunity to try and get this across into the new 10-year plan. So I think everybody should be banging in a response to that piece, drawing on your experience in sites, which is so powerful. But those of us who do have national links, I think, need to keep building coalitions and understanding that this is a long-term piece. I've been so impressed by, you know, by the work that everyone does. Has anybody put in a proposal to the a response to the change request yet? No, I really encourage people to do it, because they're looking for stories, and you've all got stories, you know, and then from your story you can tell this message, you know, and therefore, you know, investment in public libraries, investment in community service